Hi everyone, welcome to my channel. Again, this is Chididi NP, Chididi NP, and I am coming to you with another episode. This particular episode is an interesting one. It's titled Sex Ed for Adults. We'll delve right into it. I'll start with sharing the most common form of STDs and how they are transmitted, and give you some more information about really the more important ones and things that you should really be cautious about with specific STDs. So now, here are the most common or more common STDs. We have chlamydia and gonorrhea, which tend to be brother and sister. We also have syphilis, HIV, herpes. We have HPV/genital warts. We have hepatitis C. Now, if you have oral sex, meaning vagina to mouth or penis to mouth, vaginal sex, meaning vagina to penis, anal sex, meaning penis to anus, or vagina to vagina, you can definitely get any of the following diseases: chlamydia, gonorrhea, syphilis, HIV, herpes, HPV, genital warts, and hep C. Just to make sure we have dispelled the most common myth about HIV, you cannot get HIV from kissing somebody. Just wanted you guys to note that. Here are the STDs that are curable: syphilis, gonorrhea, chlamydia, hepatitis C, HPV with a caveat. So when I say curable, meaning there is a drug or there is a way to eradicate these diseases. Here are the ones that are not curable, meaning there is no known way to eradicate these diseases: HIV, herpes, genital warts, and HPV with a caveat. Now, I just want to take this opportunity to explain HPV because a lot of people are not familiar with it, and they don't even know it's an STD. So HPV means human papilloma virus. It is a sexually transmitted diseases, which is actually more common, one of the most common STDs. 1 in 2 women, meaning 50% of women, have HPV. It is transmitted usually through vaginal sex and anal sex, so penetrative sex. So with HPV, generally, the bad thing with HPV is that it predisposes people to all types of cervical cancers and anal cancers. There is 30 different types of HPV, meaning there's 30 different strains of the particular virus that causes HPV. In women, it predisposes them to cervical cancers. In men who have sex with men or in bisexual men, it predisposes them to anal cancers. In fact, bisexual and or gay men are 17 times more likely to have anal cancer as a result of HPV. There is a vaccination that does protect against the most common strains of HPV. That vaccination is called Gardasil. It's a couple series vaccine. Generally, people get it as a teenager. They do give you the option of getting it. If you are a parent, I highly recommend that you make sure that your children get this series. It really protects against HPV. Moving forward, I wanted to broach the subject of notifying your sexual partners when you have an STD. Now, a lot of people find it difficult. Some people, it can be even a threatening situation. It can be life-threatening for you to tell your particular sexual partner that you have an STD. Now, if you have an STD, it's extremely important for you to notify every single one of your partners, especially if you're not sure who gave it to you. You need to notify everyone in order to get them treated, because STDs can lead to infertility, specifically chlamydia and gonorrhea. If they go untreated, they can lead to infertility, meaning they can make you sterile, not capable of having children. They can damage the fallopian tubes in women. That is the tubes that sperm and a fertilized egg is transported through or the egg is transported to the uterus. So it's basically the transportation system of either an egg, an ovum, or a fertilized egg. So generally, it can damage that system. For men, it can also damage their system, the system that transports sperm. as well. So it's very, very important for you to let your sexual partners know that you have an STD. Now, we healthcare providers can make it definitely easier on you. We can make the calls to all of your partners, letting them know that they need to be tested and treated for an STD. Now, the way that that can happen is you can give us a list of people to call, and all we will do on the phone call is state, hey, it is very important that you get tested for this specific STD, as somebody that one of your sexual partners has this particular, has been exposed or has contracted this STD, and you would need to be tested or treated for it. That's generally how we do it. And that way you stay anonymous and your safety is not at risk. So that's very important. So I went on Instagram and I did a poll, and I asked the following questions. The first question I asked was, do you have your sexual partners tested before you have sex with them? Half of the people said yes, the other half said no. Then the next question I asked was, do you ask to see their test results before you have sex with them? Probably 70% of people said no. And then the last question that I asked on there was, how do you know they do not have an STD if you don't ask to see their results? Some of the responses were, we pray and hope that they don't have an STD. And the others were, well, we don't know. Honestly, it is actually futile to ask somebody if they have been tested if you are not going to ask for the proof. So I'm going to give you an easy way to broach all of this awkwardness that comes from or stems from broaching the subject of practicing safe sex. So I usually will say things like, well, I usually get tested with my sexual partners prior to having sex with them if I'm going to. Do you mind if we get tested together? If the guy says no, or if the girl says no, that should tell you enough. If he is able to give you or show test results within the last 3 months, and he or she can tell you that they have not had sex with anyone within that time period, he is golden or good to go. Now, of course, people can lie, but you can do your due diligence by asking about it. So again, the best way to know if somebody is telling the truth, or the best method to do this, is to say that I generally get tested with my sexual partners prior to having sex with them. And you go get tested and you ask that person if they would like to get tested with you. That is the most tried and true way of getting an accurate answer whether or not they have an STD. Now, of course, you all know that birth control only protects against pregnancies. So the other way of avoiding all the awkwardness that comes with broaching the subject of STDs is to wear a condom. And so I already told you guys how STDs, of course, can definitely lead to sterility or infertility. It is extremely important. I can't tell you guys how important that is. Not even just sterility or infertility, it can also lead to abscess formation, especially for women, that can damage your tube. So what an abscess is forming on your tube, what that means is bacteria or chlamydia, the bacteria that causes chlamydia and gonorrhea, may collect in your tube and grow and then produce pus and make your tube swell up. And so that if that bursts, or if that then goes into the cavity, meaning the area surrounding, it can cause a full body infection. You can die from it. So outside of sterility or infertility, that's also a risk from STDs. So again, I just wanted to bring you guys a different perspective of an important topic, and to encourage you guys to please practice safe sex. Another common misconception is that only ugly people have STDs. Actually, in my practice so far in the ED, I do find the majority of people that are presenting with ED are good-looking people. Yeah, so that's a myth. It's a myth that only ugly people have STDs. So I just want you guys to practice safe sex. I'm guilty of not practicing it. I have with this video hopefully given you guys a better way and a more less awkward way to broach the subject, and I hope you guys will follow that. Thank you guys for watching, and see you guys next time.